Welcome to all delegates. My code number is M22 fabrication. My title is fabrication and in vitro and in vivo optimization and characterization of remdesivir loaded floating microspheres with using methacrylate polymer of hydrazide L100 with 3 square factorial design for the treatment of the COVID-19. Remdesivir is a nucleoside analog used to inhibit the action of the RNA polymerase for the COVID treatment. It is caused by the positive sense of RNA viruses, a series of acute respiratory viruses. So it can inhibit the replication of replication by inhibiting the RNA dependent RNA polymerase by nucleotide triphosphate and packaging of these viruses throughout our body. So before going to this GRDDS, we can uh, discuss the conventional doses from drawbacks. When we are remdesivir, we are administering through the oral administration. We have some drawbacks like poor bioavailability, dose frequency, GA instability, first pass metabolism, short half life, and also for the drug related side effects. So formulators are marketed through IV route. So when to first of all we have to reduce this oral administration drawbacks that we can when we are we are formulated into GRDDS with floating microspheres, we can achieve these we can overcome these drawbacks. So GRDDS is nothing but gastroretentive drug delivery system. Retentive means remain within the gastric region to avoiding and the drug releasing it can avoiding into the intestine. So when we are formulating into the microsphere, floating microsphere, when we are administering through the oral administration, it reaches to the gastric stomach region, and it in floating condition it will be the drug will be stay for a prolonged period or retained for a prolonged period, and it can be it will not escape from the gastric region for the prolonged period, so that the drug is absorbed through the systemic through the stomach to into the systemic circulation. By that we can decrease the first pass metabolism and also the enhanced bioavailability. uh, the objectives, Remdesivir is formulated by using a solvent diffusion method by QBD DOE application. So the in vivo evaluation are incorporated in this design and optimized this Remdesivir loaded optimized formulation. That formulation Hmm. Characterized by the FTR, DSC, XRD, and zeta potential and particle size. After that, we are evaluated the in vivo kinetics floating time is estimated by the radiographical images of the gastric retention, and pharmacokinetics are determined by the PCT profile. And the method is prepared by the emulsion solvent diffusion method. The two solvents we are taken in 1:1 ratio. Within that, a drug and a polymer, floating polymer like hydrazine and 100 we are used. Other retarding polymers like ethyl cellulose and HPMC also added into these solvents and dissolved properly. And after that, dropwise we are adding into the aqueous solution of 200 ml of 1% of PVA. The microspheres is formed. After that is stirring for some for the time period and at 100 rpm. So after formation of the microspheres, it will. Next one is DOE 3 square factorial design for the floating microspheres. These are the independent factors and these are the dependent factors. Independent factors are the EL100 is as a X1, and steering process factor is nothing but the steering time is X2. This is the three levels: medium, high, and low. So our goal is to these independent factors are particle size should be minimized and the remaining should be maximized. So after that we are developing generating the formula for the 9 runs, and these are the values incorporated. And the further optimization by the graphical plots with the polynomial equation. These graphs indicate 3D graphs, contour plots indicates that it is floating above the surface, indicates that there is no or less a little interaction with the factors. And particle size and entrapment efficiency, DRE, and floating are generated with the polynomial equation of REL. So within that, uh, the entrapment efficiency with the high linear and quadratic efficient, it is a high linear and quadratic coefficient, and also the X2 is having the strong effect with the moderate interactions. Next one is second strongest is the drug release. Next, ramp. This is the numerical optimization. RMP solution shows that desirability is 1. That indicates that it should be near to 1. The parameter should be near to 1. That means all the goals are achieved perfectly to meet the design. So whatever we prepared the design, that is perfectly met. And the overlay flat indicates that optimized whatever the independent factors and dependent factors. Independent factors optimization is the polymer concentration is 50, and stirring time is 1 hour. These are the dependent factors. These are the predicted values and experimental values. By this, we calculated the percentage of prediction error calculated by experimental value minus predicted value divided by experimental value into 100. So it shows that all the values are below the plus or minus a 10 percentage only. That indicates it is a excellent model. FTIR of remdesivir and OREL for the characterization of drug and excipient compatibility studies. So that indicates that opposite of 4 micrometers with a good polydispersibility index of 0.25. That means it should be below 0.1.5. So it shows that the good colloidal stability due to the sufficient electrostatic repulsion between the particles. Some shows that the spherical distinct and exhibited porous and even surface of the follow. This is the spherical distinct with each other, and halo and porous indicates that the floating properties. And in vitro drug release shows that it follows the zero order by regression coefficient 0.99, and it follows the Higuchi diffusion model. R square value is 0.99 compared to the Casimir peppers. And in vivo studies are withdrawn albino western male rabbits. We taken 200 to 250 grams, and in vivo studies, first X-ray images were taken for a optimized formulation before administration. After 3 hours, the bariums after administration of the barium sulfated loaded remdesivir floating microspheres after 3 hours, 6 hours, 10 hours were observed. That indicates that it is prolonged residence time of the REL. These second pharmacokinetic parameters are estimated with the PCT profile. These are the significant increasing 9-folds increasing of the HVD, and AUC is 7-folds, and MRT 9-folds, and HVD ratio is greater than 1.25, indicates that it is a extended or controlled released formulation. And this is the summary. Summary. There is by the design, the optimizer polymer concentration is 50, and stirring time is 1 hour is determined. And the in vitro studies, these are the results: particle size, entrapment efficiency, floating time, and drug release. And in vivo studies, HVD is increased to 7-folds, MRT increased to 9-folds, and HVD bioavailability is 6-folds, and HVD is 8.8. It is greater than 1.5, indicates that it is a control control released. And conclusion, this is the first report of the success development of the floating microspheres for the remdesivir, offering a sustained release profile and improving the therapeutic potential. The system efficiently reduces the dosing frequency and maybe enhancing the patient compliance within the antiviral therapy. These are the future aspects. This I concluded. Thank you.